is it?
Game time.
Yeah.
Showtime.
And here we are, just for you.
Yes.
Our audience, those of you watching this after the live recording, this was done live as a streaming event on YouTube. Channel members got notifications, and people who are subscribed and have notifications activated were told about it in time to join us
Right.
live so they can comment. Like Rusty Bernard.
Like people already joining us.
And our new channel member,
Suki. M.
Suki, also. Welcome. And we're going to be talking about a medical...
Suki M. That's
Suki
the
M?
differentiator from the other Suki.
Suki M, we want you to know that we appreciate you being a
We
part of
do
the channel.
appreciate it.
We will be talking about a medical topic shortly. But first, let's get caught up on
But
the
first,
last week.
this.
But first, this message. So-
A lot has happened since last time we had this
Oh,
on.
yeah. We talked...
A lot of progress in the way of COVID.
I'd say more like regression rather than...
Regression for some things, progress for other things.
So, last time we talked about the first vaccine. Now we have a second
it's exciting.
vaccine that's
Moderna just
looks
came
to
out
be
with their numbers.
as effective or more effective and
Right.
a little easier to distribute, although maybe a little bit behind on the amount of time they've had to test it. It looks like
Right.
to get a good safety data, they probably should go on a little bit further, which the interesting thing is if they go ahead full steam and get things moving, by the time this would be actually given to people, they're going to have more data.
They'll have
So
all the data they need.
I think part of warp speed, the vaccine development, the idea is you just go ahead and keep doing it and then see what the data shows when you're ready to distribute.
Ready to pass it out, sure.
At least with two of them, if one of them turns out to have really bad safety data a month or two from now, we can go with the other one.
Scrap it and move on to the next one, sure.
With 100 million doses already made.
They're all...
But hey, that's how you get it out quick.
Yeah. Shout out to, so we already said hi to Suki and Rusty. Thanks for
Yes,
showing
we
up.
did.
You guys were here early.
Because they were commenting before the show was going.
Strong work, a good showing there. But also Andrea from Adelaide,
Australia. Triple A.
And Bianca. Thanks for showing up. And Sheila Sampson, not a channel member, but you can become one.
Who? Shelley Simpson?
No, Sheila.
Oh.
Sheila Simpson.
Oh, I thought you said Shelley Sampson.
That's somebody else.
That's somebody else. She watches sometimes, I think. Maybe
Yeah,
not. She's
not
kind of
much.
busy.
Not much.
She's in charge of a crew.
People are already asking questions, but where do you want to go with this? Where to start? What are we talking about today?
Well, I'm
Those are
glad,
a lot of questions
I'm
I
glad
just
you
read.
asked, Dr. Gwaine of drgreenknight.com.
Hey. Nice plug.
So the blog, drgreenknight.com, talked about what we refer to in our world here using the EPIC computer
The EMR.
electronic medical record.
Yeah.
We call it Open Notes. Now, I think Open Notes is actually another product.
I think so, yeah. I Googled it and some other stuff came up.
Yeah,
So it may just be...
I think it's like a productivity
Right.
software. So I'm trying to get away from that. And the title for the video, I didn't use Open Notes.
Right.
It's an open medical record or available medical record or available doctor's notes for the patient to be able to read what the doctor wrote.
Right.
What's a doctor's note? Progress note. What is it?
So progress note is a note that we as doctors make every time you come to the doctor's office. And if we're following an illness over time, that's why it's called a progress note. We kind of say the progress we're making. But every time you see us, we need to document everything that went on in that encounter. So a basic progress note has a few different areas. There's a subjective area where we just jot down what you tell us. There's an objective area where we jot down our findings with a physical exam or anything else that we did.
Vital signs.
Vital signs are those in there too.
Objective.
And then the bottom part is an assessment and plan, what we think's going on or know is going on.
The diagnosis.
Yep. And then our plan, what we're gonna do, what we have done, and what our future plans are if things don't work. Just kind of
The treatment.
Yeah. His one word apparently clarifies everything I'm trying to say in paragraphs.
In my mind, it does.
So that's a basic progress note. Now that is just one part of your medical record. If we go back to, you remember paper charts. If we go back to paper charts,
Remember
literal
paper?
manila folders,
Remember paper?
the good old days.
You could tear it. If you didn't want somebody seeing what was written on it, you could eat it.
Wow. I ate paper when I was a kid too. Okay, who hasn't?
Anybody else familiar with the biography of Frederick Douglass, where he made the free papers for the other people who are going to escape with him? They asked him, "What do we do with our papers?" And he said, tear it up and eat it with the muffins.
What else would you do with it?
Yeah. Well, they couldn't drop it because then the people that arrested them could find it.
Be picked up, right?
Yeah.
So when we had these old charts and the EMRs, these electronic medical records are kind of fashioned out of or similarly to those old records. The old records would have these tabs of each thing. So the progress notes, there would also be a tab for
test results,
labs, test results, X-rays, consultants. If you saw, a
death certificate.
Specialist. I kind of closes the chart. Yeah, that would be on the top of it. Some get more than others.
Medical examiner, why does this guy keep calling me?
Yeah. So that
if you don't get that, just move on.
The electronic medical record is similar. So if you were to look at our electronic medical record, it's a little confusing and needs some orientation for sure, because there's tabs all over the place and all these click boxes and.
You're not going to see that as a patient. Don't worry.
You don't see that part.
You
Fortunately, the patient-facing portal is a lot more user-friendly.
Yes.
But it's essentially the same thing. We got tabs for progress notes, tabs for X-rays, labs, pathology reports. Consultant notes actually go in the same area, and it's all tabulated.
Again, the patient side of it, that's kind of all one thing.
So all of that is information that goes into your chart. Now you may say, "Oh, I never see the doctor, or they probably don't have any information on me." That may be true, but even sometimes in between visits, we have to make a call to a specialist, or we call you call us for a refill of something. That goes into your chart. Every contact that you make with us, and sometimes when we make a contact on your behalf,
you try to find us on Facebook. It goes in there.
Really.
Everything.
Yeah. Now they're not going to trust the EMRs. Well, let's add that to that.
You do a search for Paula Abdul and Voltaren, and it's in there.
That came on my feed today, strangely enough. Anyways,
it knows what you're searching.
It knows. No. So it is. Everything's in there. It's all your medical history and record in one place. So it used to be we would have we still do. We have a patient-facing portal where you're able to access that, and it was really basic before. You could access some basic test results, medications, maybe a vaccination record, but now you can access everything.
So this is brand new. This is like
this is new legislation as of the
2 weeks,
beginning of November.
At least in California, I don't know if it's nationwide, but in California anyway.
Yeah, I actually don't know.
We actually don't even know, but we do
think
know.
it is because it was the Cures Act, part of the Cures Act, which is a nationwide legislation. Right? So
you can see your medical record. Certainly in California, he thinks the whole nation, possibly. You can.
Don't quote me on it.
You can see what we wrote.
All my dictation errors. You can see that.
Dictation error.
Oh, some of those are bad too.
Look up the Dr. Green Knight with the dictate.
Oh,
You've done
man.
a couple of them.
I've got 3 of them now. I've got another one coming down the pipe because I get so many. I think I had a few but most of them are mine, which is a little scary.
So you can see them in the medical record.
Yeah. So now that's where we're at. So the question that I propose is this a good thing? What do you think?
Well, I'm in favor of it because, going way back, like my residency, I was once taught that the way you document a medical record is, this is really dark, is as if you're sitting in a courtroom and that paper, this is back in the days of paper, and that paper that you wrote is on an overhead projector. Anybody in our audience remember the overhead projectors? Did you even have those in college?
No, I had them in grade school.
Grade school. So imagine that record you wrote is on an overhead projector, screen 10 feet wide for the jury and the judge and anybody else in the courtroom to read. How do you want them to read what you're writing? That's how I was taught.
Yeah.
So I was taught very much to write for if somebody else or if the patient had access to. Also, patients have always had access to the medical record. It is considered theirs. Now, the paper, well, that belongs to me because that's my paper I wrote it on. But the information is the patient's also. It's both of ours. So they have full right to have a copy of that. Now, I also have a full right to pay them for the paper that they copy it onto. And some doctors really stretch that out to
they charge
ridiculous charges for medical records. Do we even charge for medical records here?
I don't know.
I think we charge a minimum fee.
It's
because somebody has to do it. That's
Right.
why. But
We're not doing it as much now with some of the.
well, no, we do it
interoperability.
digitally now,
Yeah,
and I
it's
don't
all-
think we charge at all for that. Plus, if they're on the system we have, it's
It's the most
already at the other
widely
end.
used system in the United States. So
so always. I have been writing my whole career as if the patient could get a hold of this and look at it. So I'll tell you where I think about it.
Yeah.
I think about it when I'm having a discussion with a patient. I'm really wanting them to do something. I'm really giving this medical recommendation to get your flu shot or to go to the emergency department when your vitals are this bad and you're having chest pain, things like that. When something like that, and I'm documenting that I have a disagreement with the patient. That's where I get a little nervous, and I'll write, that I recommend this, but they're going to do this, or
Yep.
they refuse to do this.
I'll tell the patient.
Or
that
the
I'm
patient
gonna
declines
document
this.
that. Yeah.
I'll write it in the record, and if they look at it, it'll say what happened.
Right.
But that's probably the thing that makes me the most nervous.
For those conversations.
I mean, to write it down,
Patients will see them.
thinking, I'm writing this, and I always did this. I always write as if the patient could get a hold of it and read
Yeah.
it.
Right. Mhm.
And I think, oh, they're going to see that I wrote this kind of confrontationally. Patient refuses to get
Oh, I
their
write it like
vaccine
that
or-
too. But I tell the patient, if a patient is like for something that really I am adamant about and it is appropriate care,
Yeah.
and they disagree and we're having a confrontation about it, I will tell them, I am going to document this in my chart as
Yeah.
this, that I recommended this and you are refusing.
Yeah.
I tell them that,
Yeah.
so they know,
And that's
just
along-
so everything's above board, and you know that, I'm not gonna hide anything from you, but
And that's the same thing as what I said earlier. If the jury and the judge are reading it, you want it to say
yep,
that you wanted them to get the treatment, you wanted them to get the test.
yeah.
Yeah.
And that you explained all the things that could go wrong. So
Yeah, I'm sorry to make it so adversarial.
yeah, no,
But I
and,
think
and
that
most
when I
of,
think
I mean,
records-
it's pretty rare that we run into those things, right? We fortunately have some
Like-
very.
Like as close to never as can be
Yeah,
in the
yeah.
15 years that the Auburn Medical Group's been around.
It is exceedingly rare.
We have wonderful patients.
We do.
Yes.
But I guess, yeah, the other concern that I had was, well, those dictation errors. Because sometimes
That can be embarrassing.
they don't make sense, or it calls a he a she, or I do know your gender, I promise. It's just the dictation will change it. I have that all the time.
I'm having the problem right now with it changing your to her.
And me too. I get that all the time. Come on, Dragon.
I need to correct
Start
it.
working.
I need to
Yeah.
correct
So,
and spell that. Correct.
Here's another concern I have. The way that our program works, and I think this is actually part of the legislation, is that as soon as something is entered into the record, it is shot out to the patient
We're not done with it always, though.
Exactly, without a filter. So sometimes we're in the middle of a telephone encounter and we haven't resolved something, or a lab test comes in that has some abnormalities that we need to review as physicians, and then kind of put that through our filter and what we're concerned about. Or a test, a CT scan. This happens sometimes, right? More often than you would think. A CT scan is done and you find what's called an incidentaloma. Which is an incidental finding that means nothing. That may even be written as something concerning, oh, there's a mass on my adrenal gland.
Do you know what mine was today?
It probably means nothing. It usually means nothing, and we filter that through what we know.
So the one I had today was a chloride of 107.
At 1 point high.
No, actually, that's in the range.
Oh, that is in the range.
So it's in the range.
That is the upper end of normal then.
Yeah, the range is up to 107 for
Okay.
this value of this electrolyte. The patient writes me today, why do I have a high chloride?
Oh, I've had that before. It's not.
It was in the normal range.
Or
If
I had
it
a
was
calcium
2
that
points
was
above or
110.
below, I'd still say
Yeah, I know.
it's chloride. It's going to be normal if you check it again.
Yeah,
So
yeah. Drink a
but
little more
patients-
water. You're fine.
patients don't at all know what's, if potassium was off by 2 points.
Right. Yeah.
I'm calling you, having to come in and get an EKG, if not sending you to the emergency
Yeah.
department.
Yeah. So
But patients don't know which ones are that
are the scary ones.
that
and,
critical and that important, which ones mean absolutely nothing within a few points of the normal
Right.
range.
Mhm.
So
that part's a little
so
concerning.
go ahead and ask.
Yeah.
We'll
You have
tell
a
you.
concern.
We'll tell you.
Ask us.
Just believe us when we tell you that's nothing or that is something. Another one is a CBC.
Mhm.
If you have a normal white count, normal hemoglobin hematocrit, normal platelets, but your little indices down below the different types of white blood cells are a little off,
Slightly
but the
off,
absolute count's normal. Maybe the percentage is off, perhaps.
Right. Yeah. Not
It's
nothing to worry about.
okay to have some things out of the so-called normal range for the
Yeah,
lab.
somebody goes in there having an allergy attack, you're gonna have those numbers be off. So, you know, it's one of those that.
CT scan with spot on the liver.
Yeah. Which.
Let us see how it's described by the radiologist.
Yeah, we need to actually look at those, and some of them do need to be evaluated. But yeah, we like to filter those first so we don't put patients through undue stress. And unfortunately, I think this is going to increase stress in patients because they're going to be access to that. And then also, patients are getting shot all these notifications. I mean, if in some of my patients, that's multiple notifications per day. Some are a little more, require a little more care than others. So
Instead of the social dilemma movie, it's the medical dilemma movie.
you're getting all these push notifications about your medications.
My
and
mammogram was
everything.
abnormal.
Yeah.
Yeah.
So it is a good thing. It is definitely good for patients to have
It is.
access to their
It
records.
is.
That is for sure a good thing. It is your record. You should know what we as doctors are thinking, what our plans are, and we should lay that out for you, and you should have access to that.
We're just griping about the little things because
we are, yeah.
they add up.
They do, and
During the course of a day.
we will, address them or have to address them
Yeah.
with some of our patients. But there'll be a little bit of a learning curve, not a learning curve, but an adjusting curve here where we'll figure it out. So one of the things that I was curious was, how is this in other places? And it looks like we do have some.
Okay, before we get to that, let me
comments on that.
demonstrate our item, our merch that's available at YouTube.
You can have one.
In fact,
of those.
if you're watching this, you can probably see a picture of one of these mugs. And I thought, what would really start moving these? If we demonstrated how well it works.
they hold water.
Yes. So I'm gonna.
I gotta get
Make it
off
6
camera
feet away
so
here.
that you so that I don't cover yourself.
Okay, now you can breathe.
Whew.
Did you see that? That's
went.
awesome. Have you ever seen a mug work so well? You can get one.
There is water in there. I
Well,
will
not much
touch,
now.
I will
but
not
I've
touch
been
that
drinking
area.
all- He touched my cup. That's probably some kind of a
Foamite.
there.
So, another reason.
Words.
That brings up one of the other things that I brought up. Sometimes we use medical terminology, which
Which has in the past been terribly misconstrued by patients who thought an M was an N,
yeah,
or thought that we just spelled something wrong. When no, it's a different word when it's an M instead of an N. And
you're specifically talking about formication.
formication with an M.
Yes. Yeah.
Formication.
Yeah, I
Yes.
feel right now.
It will make you feel that way.
Google it. It's a safe word. If you
Yes.
use that M
It's a
for
safe word. It's a safe.
it's not. Don't let that. Don't let that.
Scream out.
Formication is my safe
How
word.
appropriate.
It's my safe word. What's your safe word? Piloerection. That's my safe word.
Piloerection.
Yeah. Also, not what you think it is. Safe to
What?
Google.
Some people might know.
You may know what that means.
Goosebumps, right?
Yeah, that's a goosebump.
All right.
Or the act of having or getting goosebumps. Horripilation. There's a fun word.
Nice, nice.
We have all sorts of fun because in medicine we can't just say fun, basic things. We got to have a cool
We gotta have ways.
Latin-based word for it.
Well, when
But anyways, we
when
use
your
that.
line of work has been around as long as Latin as
That's true. Yeah.
before
you
Latin was a dead
start
language,
to,
so stuff sticks around.
So you may not understand some of those words that we use in the medical record, and it's perfectly okay to ask us what those mean. I mean, you can Google them.
Yeah, actually, you may see
be
something that
fine.
is nearly unreadable, because that is the absolute most efficient way for us to communicate within the medical community, like to the consultant we're
Right.
referring somebody to, or
Yeah.
in case Dr. Gwain's covering for me when I'm on vacation and he's reading a note when a patient comes in, for a second visit for something or an exacerbation or something, for us to communicate with each other. So
Yes. Yep.
there is. No, it's medicine. It is complicated. There's
It
a,
is, it is.
There's a
And-
reason we have.
And those are very much
Nearly a
more
decade of
descriptive.
training.
Let's say it that way.
Yeah.
Those words can be much more descriptive than or efficient, maybe.
Very
Maybe that's a
specific,
way to say
yeah.
it too. So,
I mean, make the difference between the wrong treatment or the right treatment.
Sometimes, yeah. Using, for example, like a skin rash description.
Yeah.
You can describe something, I could draw it out for you. Whereas if you changed one word, it would completely change it, the rash.
Yeah.
So, anyways.
From a macule to a papule to
Yeah.
a vesicle to a bulla.
Yeah. There you go. So those are all the fun words we use. Anyway, so another thing to think about, because patients are going to have access to us using those words, and we when we're in the office explaining it to them, we don't use those words when we're talking to patients. We could try to not dumb it down, because it's not dumb.
Well, we might.
It's just explaining it in more
non-medical parlance.
layman terms that make more sense. So yeah. So let's hear. So
Your comments and
thanks
questions.
for your comments. AAA says hi. Thanks for joining us. Tegan, trying to find what. So there was a comment about Australia. You just lost like half of our audience by drinking horribly. She was saying that in Australia, health records belong to the doctor. So so do you have access to those records at all, or is it completely barred from you? I'm just curious what that means by they belong to the doctor. I just got a CT scan and told that they found a paraspinal mass. Yep, let your doctor explain that one to you.
There's probably going to be some more testing.
Probably for that one, yeah. Got to look into that a little more closely. But yeah, talk to your doctor about that.
That's a good one.
My doctor gives me everything I need to know on paper. Yeah, and that is one of our things we do too. We try to send you home with some paper that outlines the plan, it's called an after visit summary. Any medication changes, they're on there. If you need to call a specialist, we'll put their number, whatever.
I did have the experience today of, getting back to the office to put this in after the patient left. And I think they may have left the office before all that got onto.
Yeah.
So it would be available to them on the computer record.
Now you can access that.
Yeah.
Right. Lindsay Antwine, thanks for joining us. She asks, here's something I've always wondered. Is there a way to get all of your past medical records brought together in one big file?
Like paper or?
By one big file, you mean within one system? Kind of. So if you're...
Sometimes.
Yeah, so you would have to scan it in any of those old records, especially the ones that were not ever written on, never in an EMR. So if you have old records from a doctor pre-EMR, those would need to be scanned in. Or if you have an EMR that's not compatible with your new doctor's EMR, those would need to be scanned in. So it's in our EMR, at least, it's in a different place, which we can look through, but it is terribly difficult to look through those records because it is literally going page by page through a scanned PDF. So you could do it. It could all be there.
Yeah, it won't be indexed at all.
It's not that, efficient, those old records.
At least not with our current system.
Right.
But with some of the improvements I've seen lately, I'm getting a little more hopeful that stuff
right.
like
We are
that,
having better interoperability between different systems, which is
things
good.
are improving. When they first started trying to connect the computers, it really wasn't working well at all. And nowadays, we're seeing some ability to actually move stuff around.
Right.
From place to place.
Yeah, even pharmacies. We get somebody gets a flu shot at a pharmacy, we get the record of that, which is that part's really nice.
That's working a lot better than it used to, where we
wouldn't even know.
We'd have to manually enter the whole thing.
Yeah, just take the patient's word for it. Sure, you got your vaccine.
We hope it's the right one.
So in Australia, they say Andrea says yes. It's called My Health Record, and so you are able to access them. I don't know if that's the whole record or
sounds like that might be an Epic system.
Maybe a similar type thing that we have.
Yeah.
Yeah.
I don't know how much of that is outside of the United States.
Is there any way to get records from birth to now? Well,
birth to now. Well,
how old are you?
Where are they?
How old are you? All my, probably 20-year-olds and younger, they're probably all in the
So it sounds
EMR.
like
they've been using the EMR for a while.
Sounds like some of these people may not really know how limited medical records are. So the doctor's office that you're talking from birth to now, so every different medical facility that you went to would have a record of you.
Right.
And they would not all be put together. Again, unless you're like under 20 years old.
Yeah, and stayed in the same system.
But even if you're under 20 years old, there's still some paper records somewhere.
Yeah, because
In the US anyway.
prior to probably 2013,
Because it was 2005 when we opened with eClinical Works.
and that was
And we were-
cutting edge.
Yeah, we were cutting edge to open up with an EMR
Right.
at that time. So,
Mhm.
yeah, anybody 20 years old or more is going to have some paper records out there somewhere.
Right.
But since a lot of people practice ditching the records after 7 years, it may
Some
not
of those
be around.
may not be around. Right.
So you have a birth
Yeah.
certificate through your county that you were born, if you're in the U.S. anyway.
Yeah. That reminds me. You once told me a story about when you went to Papua New Guinea and how they keep their medical records.
Personal medical records.
Yeah,
yes.
yeah. That's a great story. I think.
So, in Papua New Guinea, at least when I was there, I think they may have EMR there now, but back then, they made the patient be the owner of the medical record, and so it would be a sheet of paper or some papers. It was as limited as could be. They only wrote down the most basic of things on it, and the patient would carry the records, and they'd come to the clinic and they'd hand it over, and
here's my
fold
past
it up
medical
and
history. That's
torn and maybe dirty, or
Right.
maybe even have some blood on it. You'd write on it and hand it back to the patient. Now in the United States, the medical establishment keeps a copy of everything for many reasons, but one that's different that I think of between here and Papua New Guinea is the medical legal system.
right.
The doctor has
So you don't
something
need to
for,
write.
for their defense for this is what I saw and this is what I treated. Whereas somewhere where they really don't have malpractice attorneys.
Right. You just jot
Yeah.
down 2 lines about what you
If the
what you
doctor
did.
if the doctor was taking care of your loved one and they died, your tribe comes over and attacks the hospital, and anybody who belongs to a tribe that the employees of the hospital belong to, and you try to kill that was going on when I was there.
Yeah, that's crazy.
How many years ago? That would have been 96 or so.
Yeah, 20-something years ago. That,
Yeah,
the,
24.
like not the
So-
not too distant.
So that's how they handled it back then. I think there's been improvements since then, and it's not quite as bad.
So Andrea from Australia, she said the whole record is available. So it sounds like it's
Excellent.
like we're catching up to you. That's what
Very
it
good.
sounds
Yeah,
like.
that could be.
And then these people who are asking where they can get their whole record, they're 68 and 60. So unlikely that your whole record is out there still.
Yeah,
in
unlikely
some
you're still
form.
going to the same doctor who was your pediatrician.
Yeah,
if-
and it's
if you're in your
unlikely
60s.
that whatever your doctor was 40 years ago, when you were still an adult, is that those records are even
I can almost certainly tell you they're not
anywhere.
digitized.
Yeah. They may be in somebody's
They don't.
file
They,
system
they probably
somewhere,
don't
but
exist.
there's no way to.
They probably don't exist. Yeah, because
You're only required to keep them for 7
back in the
years.
paper
Yeah.
world, I remember files. Well, I remember files took up space. You actually
Yeah,
had
you'd
to-
actually purge them after.
part of your
Yeah.
office space. When you pay for square feet of your office space, part of what you're paying for is old record storage.
You remember when we came into this office and they had the
They had the
yeah, like the ones you'd roll.
Yeah, it was like a whole wall of two
Right.
two files thick, and one would go in front of the other. And
Yep.
yeah, that was how they used to do it. And so there's a reason to purge stuff that's more than 7 years old. You find
Yep.
and
It
so
costs money for space. Yeah.
filing people would go through and they'd try to find records that somehow had. I think they'd put stickers on them every year, so you'd know
Yeah.
how
right.
updated
You'd know
the
when
chart
last
was.
person
And
they
so
were
you could
sent.
look through by the color of the stickers or where
Remember that? Yeah.
and see ones that were over 7 years old, so you could just throw them out.
Right. Crazy. We've
Um,
come a long way.
Although we want to keep pediatric records till after they're 18,
Right.
because they can make a decision to bring up something that happened to them when they were a minor and they weren't able to make their own decisions, and so now they can say, yeah, I want to go back and look at this with an attorney. And, yeah,
Yep.
see.
Oh, Andrea from Adelaide says AAA. Sorry, I'll just call it that. It's too hard to read that.
Andrew from Adelaide, Australia.
No one has the amount of litigation that America has. You're probably right. So that's
Yeah.
what we have to think of every time we write that malpractice check.
Okay.
Malpractice insurance check. Sorry, not
Yes,
the malpractice check.
Thankfully, our check is not as big as some specialties.
That's, right, yeah. We've got a pretty low rate in family medicine.
Yeah, with family medicine is pretty good. When you have a relationship with the patient over a long time, it's just a whole different world than what specialists have to deal with.
The only medical system that doesn't destroy records is the military, according to Suki. And I think that's right. And actually, the military was cutting edge with their EMR. They had it long before the civilian.
Well, I do remember the first EMR I worked with was at the VA.
Me too. Yeah.
And that was in...
Yeah, they had it before the rest
90
of the system.
Well, wait a minute, 93 for me. Well, no.
I was going through that would have been
95,
09.
96.
So in 09, the EMR through the VA was fully integrated, everything. Whereas the EMR through the civilian hospital they had it, but it wasn't fully integrated. Everything was kind of parsed, and they still had written notes.
Yeah, I was in it in the very early days when all we had was imaging and lab results.
Oh yeah. Yeah, you wrote your notes in it when I was.
Yeah, we didn't. Yeah, we still had paper notes.
Right. Yeah. Yeah.
Big old binders you'd flip over.
Right.
Pages of
emphysema. Oh, okay.
You have to go back and read it. Other people's handwriting.
Yeah.
Oh man.
Yeah.
Okay, I'm not going to complain about Epic anymore.
No, I know.
Now that I think of that.
I know. And people had to read my handwriting.
Yeah.
And you think about that too.
Right.
So, yeah. They still had that in my residency.
I printed.
Crazy enough. Yeah.
In residency.
You printed.
I did.
Cursive. No, I actually don't. I print too. But you still couldn't read it. We take a class on that.
How to sign.
How to make your notes illegible. All right, so there you have it. Open notes.
We're caught up?
I think so.
With our wonderful audience who's
thank you
came
for
here to
joining us.
learn something about medicine.
All of your channel members, thank you for your interaction. Appreciate it.
Thank you so much.
You make the show go.
And
it holds
that's
water.
why we provide cups that
It holds
look at that,
water.
it's not even leaking. Oh man, so I'm sure that there's going to be a run on these.
Probably. Get it while we still have
Look,
them.
yeah, that's one
Good thing we got
Look
ours
at
early.
That is a pretty cup. Did you see what the back looks like?
That's the. Why don't we show them that part? Because it's hard to see this far away.
Yeah.
But that is the better side of the cup.
Oh man.
See
That's a
here's
good-looking
the
cup.
thing. It's on that side. So when you're holding it, that side's out.
If you're right-handed.
If you're right-handed.
If you're left-handed.
Most people are right-handed. That's why I assume.
If you're left-handed, you get to
you
just
get to look at us all day.
Yeah.
Apparently, we favor, we really like or really dislike left-handed people. Whichever one we're doing. If it's a good thing or a bad thing.
I don't believe there's an option to. Oh, you know what? Maybe there is a way to. Oh, maybe we can make right and left-handed version.
Oh.
So this is the only version available now.
Which is, would that be the right-handed or the left-handed?
I don't know.
We don't know.
What if somebody ordered it and they actually did it the other way for?
Just so you
I don't
can
remember
see.
a way to indicate a handle on right, handle on left, front. Maybe there was a front and
We're
back.
talking about this enough that we need to have some.
I'm sorry.
Probably buy them, right?
Yeah. Tell us how you like the cup. Take your picture with it on Instagram. # Auburn Medical Group, and we will show it on the show.
Absolutely. So
All right.
before you, or right after you log off here, make sure you go over, check out drgreenknight.com. Check out my article on this whole access to medical records. And click on over to some of those dictation errors. Those are always fun.
And
Three different.
I'd also like to let you know that I do have a podcast called Dr. Von's COVID-19 Updates. You can find it wherever you get podcasts. And it has up-to-date information on what's going on with the
And a
pandemic.
very hopeful podcast today.
Oh, you heard it.
I heard you doing it.
I think you may have made some sounds that are in it.
Typing.
Yeah. So
Yeah,
sometimes you can hear Dr. Gwen in the background.
In the background.
It is a daily podcast, so we don't
hear
do it in the
anything
studio.
weird.
Anybody want to thank?
Absolutely. So I want to thank my Patreons over at Patreon. Dr. Green Knight is the handle there. Boo Boo Kitty and Teresa Watt, thank you for what you do. You make it happen.
All right. And
How about you?
I'd like to thank Lindsay Entwine and Boo Boo Kitty. Thank you for being
And Lindsay
on
was here today. Thanks for joining
Thank
us.
you for being on the Dr. Von Patreon.
And Teresa was here. Oh, and she said very
Man,
nice.
So many great people.
Yeah.
Until next time,
Hey, I'm Dr. Dwayne Vaughn.
And I'm Dr. Mark Vaughn.
Still.
telling you to stay in good health.
We'll see ya.
I think that's a show.